Hello, everyone. Thank you for joining us today. So I'm glad that you could all make the time to be here with us today. My name is Tracy Mwiti, the Program Coordinator at Hope Arthritis Foundation, and I'll be your moderator for today's session. So I can see we have quite a number of participants that have already joined us, and I'd like to warmly welcome you all on behalf of Hope Arthritis Foundation. We truly appreciate the time you've taken to join us, as some of us were able to join us for the first session last weekend on 14th and are still here for the second session. So we truly appreciate that. So as we give other participants time to log in, we are going to take part in an icebreaker, a very short icebreaker. So what you're going to do, I'll be sharing a link on the chat. So you're going to click that link and then fill the questions that you see there. I hope you all can hear me. If you can hear me, give me a thumbs up. Thank you, Esther. Thank you so much. So I have shared a link on your chat. Just click that link and then you can answer the questions that are going to show. So there's the first question. I hope you're able to log in. Use the link that I have shared in the chat. Fine, fine. Someone is feeling fine, excited. Wow. Fantastic, encouraged, awesome. Great, great. I am loving the responses. I am loving the feelings today. Next question. Algeria, wow. Thank you. Nairobi. London, awesome. That's good to know. UK, awesome. Thank you. Anyone else? We don't want to leave anyone out. So if you can see the link on your chat, just click it and you'll be able to join this lovely icebreaker. Okay. Last question. Are you ready? Are you ready for the session today? Are you ready for the session today? Yes. So I believe majority of us are ready. We already have 4 yeses, 5 yeses. That's great. That's great. Thank you so much. Thank you so much. So those who have just joined us, my name is Tracy Mwiti, the Program Coordinator at Hope Arthritis Foundation. So before we begin our session today, I'm going to share a few house rules just to ensure that we have a seamless session. So number one, please keep your microphones on mute unless you're speaking. And if you'd like to speak or ask a question verbally, you can use the raise hand feature and we'll give you an opportunity to speak. But feel free to have your video on if you're comfortable, but you can as well have it off. Then use the chat box for any questions or comments during the session because you're going to have a dedicated Q&A session at the end. So just keep the questions coming in the chat box, then at the end, we're going to address them. And then kindly note that the session is being recorded for future reference. So you should note that it's being recorded and you've given us the consent to record while you stay in the session. So that is all for the rules of the house. So before we begin with our first speaker, I want us to take a few minutes to complete the pre-course assessment. It's just a few questions. It shouldn't take more than 3 minutes. So as we still give time to other participants to log in, I'll share the link. So if you can see the link in the chat, just click on it, fill in the questions there. Whatever you know is fine. Whatever you don't know, it's still fine. That's why we are here today to learn. So don't feel discouraged if you find a question that is a bit tough. So I'll allow you to take 2 minutes to fill in the pre-course assessment. I hope you can see the link on the chat. So as we continue to fill in the pre-course assessment, I'd like to inform you about this course, which is the Hope and Healing JIA Masterclass. It has 2 parts. We already had the first session last weekend on 14th. So this is the second session of this course and the last one for this particular course. So we are going to be awarding certificates for those who complete this course, and there are a few requirements required for you to get your certification. So first, you need to take the pre-course assessment, which is what you're doing right now, and then you need to attend the 2 sessions, one that occurred last weekend and then this session. And then after attending the live sessions, you also need to take the post-course assessment, which will be shared with you, and also give us some feedback about the course. So once you meet the requirements, you'll be able to get a certification for completion of this particular course. So without much further ado, I would like now to introduce the first speaker for today's session, who is Lynette Botte. Lynette is a youth group leader of Lupus Europe, a patient representative, and senior social worker in the UK. So Lynette, thank you so much for being here today. The floor is yours.
Hello, good morning, Tracy. Thank you very much for the introduction. introduction. I'm just going to share my slides with you, and please let me know if you can see them.
Yes, we can see.
Okay, thank you. Let me just put it on slideshow. Okay. Okay, so good morning, everybody. So I'm doing a presentation on the role of patient support groups in care of juvenile idiopathic JII patients. Okay, so as Tracy mentioned, my name is Lynette Borte, and I have lupus, SLE, and have had this condition for 23 years. Although it is a condition that has a lot of complications, I see this as my strength, and it has made me the person I am today. Um, I love to empower others with lupus to help them realize their potential with the right mindset and support. I'm an ambassador for lupus and work for Lupus UK and Lupus Europe as a youth leader. This work involves me to support young people who are newly diagnosed with lupus all around Europe. I co-lead the Young People's Lupus group with the former chief executive, Paul Howard. So I co-led that support group with him. Through working with the lupus support group, this led to other opportunities, such as working on the treat to target strategy in children with SLE. This strategy defines a treatment target, such as remission or low disease activity. It was an honor when I was added as the co-author on the principles and recommendations for the treat to target paper. So in September 2023, I was invited to the 29th Pediatric Rheumatology European Society Press 2023 as a speaker when I gave my talk on experience of living with lupus. So I entitled this talk, I Didn't Know My Own Strength. I have received extremely positive feedback from healthcare professionals from all around the world who were intrigued by my lived experience. Sorry. I've worked with various senior stakeholders in the health setting in which I've represented the patient and public voice as someone who lives with a rheumatic disease, lupus. These stakeholders include health and social care professionals in a charity and research setting. I'm a qualified senior social worker for over 10 years and work in the fostering and adoption setting. In my spare time, I love to travel. I love warm and sunny countries because the UK is not always warm. And I love to explore different cultures and scenery. I enjoy going to the gym and keeping fit and love attending live concerts in the theatre and also love going to church as well. I enjoy spending time with my family and friends. In November 2023, I was successfully appointed for the role of the patient public voice of the clinical reference group with NHS England. I'm very much looking, so I sit on that board and I talk about my experience of lupus. And in August 2024, I was invited to speak at a pharmaceutical company in Brussels in Europe, which is called UCB, where I spoke about my condition and the unmet needs of lupus. So I'm talking about support groups. What are support groups? A support group is a gathering of people facing issues to share what's troubling them. And through sharing experiences together, they are able to offer support, encouragement, and comfort to the other group members and receive the same in return. Support groups also focus on emotional support, sharing experiences, education, and practical activities. And it also supports one-to-one support sometimes and called mentoring, and also others befriend each other. So you gather together, everyone's meeting each other and talking about how they're feeling because they've got the same common goals. Support groups bring people together, people who are going through or have gone through similar experiences. For example, this common goal might be JIA. So, in my experience, when I set up the support group and ran it, it was the common ground was lupus. So, with support groups, one of the theories that I felt supported this was the well-being theory. So Parfit 1984 divided theories of well-being into three main types: the subjective well-being, the hedonic theories, and the desire theories. So with the subjective well-being, this defines well-being as the way a person thinks and feels about their life. So we all think about a certain way of how we feel about our life. And it bases well-being as being very much linked to emotions, feelings, and moods. So when I was part of the support group, one thing that really affected us was our mood. We've lived a normal life until we've got this rheumatic condition, and then it obviously affects our mental health. So one thing we all were able to share together was how it affected our mood and how it affected our mental health. So coming together, we were able to support each other on strategies on how to support each other with our mental health. The hedonic theories, these associate well-being with happiness. Well-being is seen as a fundamentally about maximizing pleasure and avoiding or minimizing pain and painful experiences. As someone with a rheumatic disease and patients with JII, we all desire to be well and lead a normal life as possible. So, coming together to talk about this, we can give each other strategies to say, like, I journal every day to make sure I can get my emotions on paper and I share those strategies with people, or I write lists of what I'm going to be doing in the morning, in the afternoon, and the evening. And this helps structure my day. And especially when I suffer from a lot of fatigue, it just helps me manage what I'm going to be doing from A to B to C. So it's about sharing those strategies together. And the last part of this theory is the desire theories, which link well-being large desire theories link well-being largely, if not solely, with the satisfaction of desires. So essentially, our well-being is seen as reliant on us having what we want out of life. So what is our goal? So when I was younger, my goal was to become a lawyer, but I had to adjust that goal because I became unwell. So I reframed that and I said, okay, I want to help people like others have helped me. So I said, let me let me become a social worker. So it's sharing about those goals together, and also we can share the life goals as well as health goals. So obviously my health goal is obviously to be in remission, which I'm very proud to say that I've been able to reach that. And we talk about strategies in order to how do we get to remission? And that's for me, it's exercise, making sure I took my medication, making sure I balance my life out well. And by the grace of God, I am in remission. So desire theories link well-being with theories of need such as Maslow's hierarchy of needs, which enhances one's well-being. So Maslow's hierarchy of needs is five, there's five areas, and it's a pyramid. And from the bottom of the hierarchy upwards, the needs are physiological, food and clothing. So we all need physiological food and clothing in order to keep us alive. Safety, that safety net, that safe place, having a job, having security in order to support ourselves financially, and belonging, wanting to belong as part of the community, having friendships. So that's one thing a support group really helps with, having that belonging of, oh, I'm meeting other people that know exactly how it feels to have a condition like lupus or JAI. And that feeling of not being on your own, because when you miss so much school or work, it can be a lonely time. So that sense of friendship is a really good way, it's a really good benefit that support groups can support you with. And it just helps you build your self-esteem. And the last part of this theory is the self-actualization, just actually realizing you can achieve what you put your mind to if you get the right support. So I touched on it a bit just now, but the benefits of support groups. So JIA patients will not feel alone during a daunting and overwhelming time, especially those who have been newly diagnosed. So that's one thing when you're diagnosed, especially as a child. I was only 11, and it's a very daunting and lonely time. And when you meet others that feel the same, you feel like you're not the only one that feels like that. And generally, just having a better understanding of what JIA is. I didn't fully understand what lupus was when I was fully diagnosed, but it helped when I met other patients because it helped build my knowledge. And we always had like doctors and speakers, and it really helped me get a better understanding of the condition. And JIA patients will have this as well. Talk to other peers who also have JIA. There's nothing more powerful about speaking to your peers, others that share similar symptoms and have similar experiences. Understand better how the condition can affect you. So I mentioned this just now. It's just understanding what might happen to you, why that's happening to you, why you're having those certain symptoms, and just getting the right support from your peers, the right physical support, the right mental support, and the right just peer to peer support. It's really, really powerful. And then feel autonomy over your own condition, just owning it and knowing, okay, I feel tired sometimes, but I can make sure I map out my day so I can get rests so you can make the most out of it. And discussing and learning about different treatments. So there are different treatments in rheumatic conditions. So we would always compare and see. Sometimes it's a bit of a trial and error. So what worked for you might not work for someone else. But if you share it between you, then you can discover if that condition would work for yourself. Personal experience of support groups. So I first joined a support group when I was about 16. And honestly, I can say it's really made an impact on my life. And I really, really enjoyed it. So I first got involved when my doctor set up, my consultant at the time, he set up a support group, and my nurse at the time. And my nurse went on maternity leave and asked myself she could see I was quite active and very supportive of other patients. And she asked if I could co-lead it with the chief executive of Lupus UK. What I gained from joining the support group. So it's invaluable what I gained. I've gained really good friendships. I've gained how to support and empower others. And I've just gained general self-confidence. It really, really boosted my confidence to realize people can lead a real normal day-to-day life. People can have children with a rheumatic condition because we've got quite a few mums in the group now, and we're at that point where, because we started it so young, my friend and I are creating a new older group because of we're at that stage where we want to start families. So you can birth another group out of the original group, which is amazing. And how support groups have led me to be an ambassador for lupus. If it wasn't for me joining the support groups, I wouldn't have been an ambassador, and I wouldn't be talking to different organisations and be a patient public voice for NHS England. Um, it just makes me so passionate about supporting others with rheumatic conditions. And I just really, really am passionate about you can do anything when you put your mind to it. So those are my references that I used to support these slides. And the last part of my talk I'm going to talk about is transition. So in the UK, I was in a children's hospital, and I just want to talk about my experience of what a good transition looks like. So good transitions from childhood to adulthood in healthcare is important. I've got friends that haven't had a good experience, but was very fortunate to have a good experience. So when I transitioned from my children's hospital to my now adult hospital, it was done very carefully and very um just very, very sensitively. So in order to have a good transition, multi-agency working is absolutely key. So my consultant for my children's hospital to my adult hospital was they met together and they made sure they spoke about my care and shared that key information. So as mentioned, sensitive transitions with doctors from pediatric hospital, they were still involved for a long time. They didn't just let me go to the hospital, the adult hospital, and said, okay, bye. They stayed involved for a while, and that was key in a successful transition. So familiarity. So I was introduced to my new hospital, the adult hospital, slowly. So I was taken there to see what it looked like, so I could see what the place would look like, and because I was very young, it was just helped me understand where I'm going to next, and I felt that really helped. So as a child, you don't feel like you're just being thrown into the adult world. So I didn't start off with being straight into the adult clinic. I was put into an adolescence clinic. And I was in that clinic for a while before going into an adult clinic. And that really, really helped. And just speaking to a child in child using child-friendly literature. So it's so important that the jargon, the medical jargon words weren't spoken to me. It was just normal layman's terms. And that helped me understand what was happening and what my treatment was. And then parental and guardianship support. So my mum always came with me until I was confident enough and grown enough to be able to do it with myself. So parental and guardianship support is so key because as a child, you might not always understand what is going on. It's my mum who always made the big decisions on treatments because I didn't have that capacity to make those huge decisions. But obviously, we discussed it together, and your parent and the doctors can speak to you together to be able to understand what treatment and what support um is you're receiving. So it's so, so key that parents and guardians do go to appointments with their with their child because it's not always easy to understand. So I've got just two questions on my talk, and if you could just please pop it in the chat from what you remember, and if you could just please pop in the chat, what is the definition of a support group? And the second is what are the benefits of a support group for JIA patients or just for um, rheumatic conditions, or you can just give examples of like what I've spoken about. So I'll just leave that there for a good minute just so you can pop your answers in the chat. I'll just say it again, what is the definition of a support group? And what are the benefits of a support group for like JIA or children with rheumatic conditions? Okay. And thank you very much for listening. I'm going to check. I can't see the chat right now, so I'm going to stop sharing and then I'm going to see if there's anything there.
Thank you. Thank you so much, Lynette, for your
You're
time.
very welcome.
So
You're very
I'll,
welcome. If anyone's
yeah, I'll post the questions once more in the chat so that if anything comes to you, you can just respond. So I'll repost those questions in the chat. Please feel free to put your answer there. There is no, there's no right or wrong answer. So yeah, feel free to use the chat. So without much further ado, I would like to welcome the next speaker for today, who's Mr. Martin Ongwen. So Martin is a passionate physiotherapy from Nairobi, Kenya, currently the clinical director at Afya Africa Orthopedic Services and former Kenyan program director for Therapists Beyond Borders. Mr. Ongwen has received specialty training in orthopedic manual therapy, cardiac rehabilitation, pediatric care, neurorehabilitation, sports physiotherapy, cancer rehabilitation, as well as modern evidence-based pain science and global mental health. So I'll let him tell you more about himself. So Mr. Martin, welcome. The floor is yours.
Thank you, Tracy, for the introduction. I appreciate that. I'm so happy to be here today with all of you guys. I do hope you can hear me all right and probably see me as well. Sometimes with technology, you never really know. So if you can hear me and if you can see me, you can just do a thumbs up on the chat and we can proceed from there. All right, great. Thanks, Lynette, for that. Yeah, my name is Otieno Machinongwen. I am a physiotherapist out of Nairobi, Kenya. I have different specialty trainings, but that is not necessarily important for now. But I've had a lot of experience working with people with chronic conditions, conditions that are persistent and mostly non-communicable diseases. And today we're going to be pretty much talking about um, movement and exercise. And a lot of times when people hear about physiotherapy in Kenya, they think it's about kunja kunjua. I'll also be talking in a little bit of Swahili here and there, and also kind of like try to put some emphasis that physiotherapy shouldn't and is not necessarily a painful experience whenever you go for physio. So that is going to be me trying to demystify that myth. And I want to start sharing my screen now, and then do let me know if you can see it. All right, great. So I work with Afya Africa Orthopedic Services, which is a private clinic in Nairobi. We are based in Westlands. And I'm also based in Oslo at the moment. So if I'm not in Kenya, mostly in the rural areas, trying to create some sort of awareness surrounding what physiotherapy is. Um, I work in Oslo as well. So we're going to be talking about um, the role of exercise and physical activity in JIA patients. And this is going to be just trying to put some emphasis on movement necessarily. A lot of times when we talk about exercise, people become really afraid and concerned about it being a very gym focused activity, but not necessarily. So mine is going to show you examples and let you know why it is important for us to move as much as we can in our childhood and both as adults as well. All right. So the aim really is to understand the health benefits of regular physical activity across the life course, not necessarily just when we are young. Um, and also define physical activity. What is this? What is this thing called physical activity? What is exercise and what is physical fitness? And what are some of the differences of that? And also to develop an understanding of the health benefits of physical activity and how it can help prevent and treat many non-communicable diseases and prevent premature death. And also to develop an understanding of what are the World Health Organization frameworks and a lot of the UK recommended physical activity guidelines and strategies. Hopefully, in the future, we'll have some guidelines and recommendations from the African continent, which usually rarely happens because we don't contribute much to research. So, if you look at some of the global goals for and targets for the World Health Organization, we do have certain targets that uh, are aimed at, and the goal was to by 2025 to have a reduction in, let's say, all-cause mortality, a reduction in people dying of premature death, you know, things to do with food security and also a lot of that. But this is way much focused towards healthcare. And if you look at the goal is also to kind of like improve the longevity and quality of life of people. And some of those things are like, essential non-communicable disease medicines, improving that, kind of like reducing drug therapy and canceling, coverage, things to do with diabetes, things to do with blood pressure. And one of the goals was to improve uh, physical activity or reduce inactivity of people by 10% in 2025. And what is exercise medicine? Ideally, and there is a lot of controversy surrounding exercise as medicine, but technically, exercise and movement is medicine. And if you look at medicine today and how people are starting to practice medicine is targeted towards a preventative measure, and people are starting to move away from disease or kind of disease targeted treatment and moving away towards prevention. All right. So we're looking at exercise, nature, being outside in nature, good quality sleep, good and healthy environments. Those are some of the things that medicine is starting to move towards. Good and healthy foods. What are some of the foods that we're eating? And exercise and physical activity does play a very big role in helping us reduce some of the drug usage that we have. So promoting health and wellness through the increased use of physical activity and exercise in the prevention and treatment of disease. The whole idea is to provide brief interventions on physical activity advice in each and every consult. So whenever somebody goes to see the doctor, the doctor is or the healthcare provider provides some sort of advice targeted towards movement and physical activity, and also to protect and promote the health of patients and the public. So physical activity, what is it? It's any bodily movement produced by muscles that requires effort and energy. It includes a broad range of activities, and these are everyday activities that you do as a human being, walking, climbing up and down the stairs, carrying your children, or any household chores, different occupational tasks, leisure time, physical activity, exercise, and sometimes in our schools it could be PE, they term it as PE, or physical education time, which a lot of times we have seen in a lot of schools today. We have teachers having a focus on reducing physical activity and exercise time, which is very detrimental to the health of our young children today. And there's something about physical activity that involves energy expenditure. It has to do with frequency. How often do you do it, the intensity, how much effort do you put in it, and time and the type of activity that you do. And what is exercise? Exercise, on the other hand, is physical activity that is planned, it's structured, and is repetitive and purposeful, usually aimed at improving or maintaining one or more component of physical fitness. And some of the examples are, walking. It could be a lot of times when it comes to exercise for walking is kind of like fast walking or brisk walking, and not the type of walking we do in the supermarkets when you want to kind of like compare different prices, that slow walk, trying to see, do I buy this or do I not buy that? Swimming, cycling, aerobics, things to do like, different dances whenever you're watching or kind of like in the gym. Sometimes they target aerobics as exercises that involve dance. There's yoga, there's Tai Chi, which is old Japanese type of movement. And we also do have strength exercises. And in clinical practice, we do emphasize physical activity. We do put an emphasis on physical activity rather than exercise or sport. What are some of the examples of exercises that we have? We do have aquatic exercises, and in Nairobi, we have different institutions now that do have hydrotherapy pools that are heated. And that kind of like helps in, pain reduction and also kind of just making activities in the water fun and exciting. Swimming, like other forms of aquatic exercise, swimming is very generally an excellent form of exercise for children and adolescents with arthritis. Cycling, Nairobi doesn't really provide a safe environment for cycling, but we do have a lot of people going to Karura Forest these days to, you can rent a bike and you can cycle there. And that kind of provides a very good natural environment to do this activity. And yoga, this is some of the yoga. A lot of times we think yoga is a kind of like, I'll put in quotes, European or an American thing or white people thing. But what it does is it's, just gentle, slow movements that involve deep breathing, quiet music, meditation, and things like that. And it helps in reducing pain over time, improving flexibility, relieving stress. And Tai Chi, this is pretty much new into it's used a lot in the UK, but it's pretty much a new method or a new type of movement that they're using to help people move in different ways and also just to appreciate the different movements that they can do that is very slow paced, and can really help in calming down painful joints. And it's slow and graceful, and it has been shown to improve balance, reduce stress, relieve arthritis pain while providing a low intensity cardiovascular workout. And there's a lot of research now that shows that, children with JIA can do Tai Chi type of martial act that can improve function. So the physical fitness has a set of attributes that people have or achieve that relates to the ability to perform physical activity. So the types of physical fitness, we have heart and lung endurance. So the targets the lungs and your heart. We have muscle strength, can you lift this? Can you lift that? We have part balance and coordination. And then we have flexibility as well. And a lot of this is influenced by genetics, health conditions, physical activity, and exercise. So these are some of the different examples that we have. Physical activity can be related to occupational tasks, household chores, everyday activities that you do, leisure time physical activity and exercise like cycling, how the environment is structured. Do you walk to work, or do you take the bus, or do you drive, or, how do you go about moving from point A to point B on a day-to-day basis? And then we have physical activity. Physical fitness that targets, cardiorespiratory endurance, things to do with your heart and how you breathe, how fast do you breathe, how slow do you breathe, muscular strength, your ability to lift things, and your ability to just carry your own body weight from point A to point B, flexibility, and balance. And there's a lot of massive health attributes that come with having good physical fitness and being engaged in physical activity on a day-to-day basis. And these are some of the research and articles that we use to kind of like help promote good physical activity, movement, and exercise. And there's a lot of publications right now that we have. Lancet, More Active People for a Healthier World. That's by the World Health Organization. Start Active, Stay Active, which is out of the UK, and then different recommendations for physical activity again that have been revised by the World Health Organization. Exercise, the miracle cure and the role of doctor in promoting it. So these are just different articles that help us to promote physical activity and exercise. So why should we do it? If you look at all the exercise has got very beautiful health benefits, and we can even just talk about exercise and the brain in itself, and especially for young people. Exercise has an effect on what we have in the brain as development hormones that also help in improving memory. But look at all these beautiful things that exercise can do. Reduce all-cause mortality by 30%, reduce cardiovascular diseases by up to 35%, type 2 diabetes by up to 40%, colon cancer by up to 30%, breast cancer by 20%, depression up to 30%. And depression, right now, we see depression is becoming very problematic in Kenya and also a lot of different parts of Africa. Later, as you age, reduces hip fractures by up to 68% and dementia by up to 30%. So exercise and physical activity is a beautiful thing to do. And as I mentioned earlier, why do they say exercise can be potentially looked at as a drug? So this is different researchers coming together and looking at the different drug effects on the different parts of the body in relation to and in comparison to exercise. And they looked at all those effects and found that exercise is just as effective as certain drugs in helping to reduce and manage disease processes. So if you look at exercise as an independent factor in relation to all-cause mortality, so exercise, low physical fitness showed that it's a cause of people dying early, all right? Low physical fitness, the same effect as smoking, hypertension, and high cholesterol. And this was done, these are researches done in both men and women. Exercise again, low physical fitness, a lack of physical activity and movement, just as important as other factors. Cardiovascular disease, risk of dying early. So physical inactivity is up to 30%, which is higher than smoking and hypertension put together. So poor muscle strength is also a risk factor of cardiovascular disease and low all-cause mortality. And what does this mean? It just means that the weaker your muscles are, there's a high chance of dying early and getting hypertension or dying of a heart problem. And this is not to scare you, but this is just to kind of like show you how dangerous a lack of movement is. And physical activity, it is a modifiable risk factor. It's something that we can change, And if we improve physical activity, we help in, um, kind of like prevent preventing dying early, you know. And if you remain physically active, you or improve your levels of physical activity, your risk of death and cardiovascular disease can be halved. So it's slashed into two. Physical activity, fitness needs to be current to maximize the effects. You need to kind of like improve it. And age is irrelevant. Benefits can still be gained at any age, whether you're young or whether you're old. You can still be involved in some sort of physical activity. And the more you do, the better. The more exercise you do, the lower your risk of all-cause mortality. The risk continues to reduce the more physical activity you do. All right. So the more is better, you know, and less is more sometimes, but you have to keep increasing that tempo. So these are some of the advices that are given by the World Health Organization in relation to what can you do. Reduce sedentary screen time for babies between the age from birth to 5 years. At least 30 minutes of physical activity, uh, good sleep, move more, sit less, and they also put an emphasis on playing together. The more children play together, the better they become in relating to one another. And also 1 to 4 years, what can they do? At least 180 minutes of physical activity, reduce sedentary times. How much time do our kids spend watching TV and on their mobile phones? So let us reduce that time as much as possible. In all, for children over 5 years, walking, you have 3 hours of physical activity each day, physically active, playing, cycling, walking around, running, and we need to start encouraging activity early, as early as when babies are toddlers, creating environments for the babies for tummy time, crawling, things that they can do, active play, providing toys that they can reach to, all that stuff, you know. And then from 5 to 18 years, you need at least 60 minutes of activity every day. And this can be vigorous. For a lot of the young people, the target is vigorous activity and a lot more movement. So at least 1 hour of physical activity each day, moderate to vigorous intensity, and up to several hours. And this can be done in sports and physical activities and PE in school. So, exercise has got physiological effects, psychological effects, and social effects, and as well as behavioral effects. So, things to do with physiology, you have your heart and your lungs, your muscular strength, your bone health, and your respiratory fitness, motor skills, development skills, playing basketball, etc. Your body composition, physical activity early prevents you becoming obese in your older years. Psychological self-esteem, the more you move, the more you improve your self-esteem. It has an effect on anxiety and stress. Academic achievement, as I mentioned, exercise and physical activity has an effect on memory and function, cognitive function, attention in class, attention in school or whatever it is, self-efficacy, and then we have mood. Of course, memory and body image, there's very little, outcomes in terms of sufficient evidence, but we are starting to have a lot more people look at the evidence surrounding all the self-efficacy, mood, and things like that. Social, playing together improves confidence, peer acceptance, positive relationships, social communication skills, self-resilience, and school engagement. All right. So these are some of the benefits that the children get from being physically active and participating in different movement activities. So exercise is widely used by health professionals and patients to reduce pain. And I'll mention pain because there's a lot of times when people come in for physiotherapy sessions, it's because they have some sort of pain that is preventing them from moving one way or another. It helps and improves function and strength. It improves aerobic capacity and vascular function, how your blood vessels, how you kind of your intake of oxygen and how your body kind of like releases different toxins from the from itself. Mind-body training programs like yoga, Tai Chi are promising approaches for reducing pain and improving physical function and quality of life. And this is in knee osteoarthritis, and this can also have an effect on juvenile arthritis as well. It improves how we walk, the gait, it enhances self-esteem, perceived quality of life, reduces risk of immobility and disability, management of weight, and potentially reduces risk of associated conditions such as cardiovascular disease. It's important that exercise and physical activity is targeted towards the person. So a lot of times you will need advice if you're physically active and you want to improve your physical activity levels. It's always good to kind of seek advice from someone to kind of like help with that. And then these are some of the conditions that could be. We can say that if you have these conditions, it's advisable to stop any form of physical activity unless you have been given a go ahead by the doctor. And so the considerations, you need to avoid exercises that causes pain lasting more than 1 hour after the exercise. You need to gradually build up activity. 5 minutes to 10 minutes warm up is important. Usually you can use an ice pack after exercise, when the joint is a little swollen or you feel some, pain within the joint. And then choose exercises that you enjoy. That is very important. Select different shoes. High impact activities or contact sports are not recommended for juvenile arthritis patients. Aquatic exercises are good. Avoid early morning exercises when you have the joint stiffness and all of that. So wait for the joints to calm down before you get into for any form of activity. And it's always very important to adjust and tailor exercise plans towards your experiences as an individual. Do you have severe pain during exercise? You should reduce the amount of activity that you do. Pain that doesn't settle to usual levels after exercise, that should be looked into. Increased night pain and post-exercise, that should be looked into, and increased joint swelling. It's important that you have to seek advice from a physiotherapist on what activities your child can or cannot do. It's also important to work with occupational therapists to tailor activities suitable for your child. Always seek medical advice and link your child's rheumatologist to other healthcare providers working with them. Thank you. I do hope that this was kind of like helpful to you guys, and I hope that I have passed the message of, trying to encourage you to move as much as possible. Thank you. I'll stop sharing, and
Thank you.
I'll welcome any questions from the group. So.
Thank you so much, Martin, for sharing your insights on physical activity. If you have any questions to Mr. Martin, please put them in the chat. So because of time, I'll just briefly introduce our last speaker for the day. Albert Migoa is a trained psychologist who is a counselor with the Red Cross and is the deputy team leader of counselors in Nairobi County. So, Mr. Albert, the floor is yours, but feel free to keep the questions coming in the chat. We'll address them later. Albert, the floor is yours. Welcome. So as Albert is getting ready, there's a question on the chat. Martin, you can respond to the question.
Oh.
Yes, Albert.
Tracy, kindly, if you're able to just share the presentation that I shared with you, the revised one. I'm unable to share because I'm using my phone.
All right, give me a second.
Okay. Go back and forth. Here's it. Okay. So can you all hear me?
Yes.
Hello.
We
Can I
can
be
hear you.
heard? Am I? You can, eh?
Yeah.
Okay, thank you very much. So good afternoon, everyone from East Africa. Good morning, good evening from whichever part of the world you're joining in from. My name is Albert Tiara, and I'll be taking us through supporting mental health for juvenile idiopathic arthritis patients and guardians. So just before I comment, just a few ground rules. For me, this is adult learning, so I'll be calling on each and every one of us to participate through either giving of your comments or questions. So it needs to be very active. In the event you've got anything to say, can use the chat box. When one is speaking, kindly let the others mute. Next slide, please. Okay. So as an introduction, mental health is a very key component of patients and guardians who have with juvenile, either you're suffering from it or you're caring for a patient suffering from juvenile idiopathic arthritis. And here, the whole idea of mental health is to improve your quality of life, treatment, educational, social outcomes, giving appropriate coping mechanisms, and the overall well-being. Next slide, please. So what's the objective? One, really to, away from understanding, but really to identify the mental health challenges of JIA patients, to identify mental health challenges for guardians, to identify coping strategies for parents and guardians, and to build resilience. Next slide, please. So just to put us back into context, what is juvenile idiopathic arthritis? Well, it's an autoimmune inflammatory disorder that primarily affects children and adolescents under the age of 16. It is characterized by persistent joint inflammation, which leads to pain, stiffness, swelling, and potential joint damage. And the term idiopathic indicates the cause of the arthritis is unknown. Next slide. So just to touch on them, I will not get into details due to time. I'll just quickly mention them. So there are different forms of GIA. You've got oligoarticular GIA, and this is the most common type, which is characterized by inflammation of fewer than 5 joints in the first 6 months of disease onset. We've got polyarticular GIA, which is This subtype, you've got 5 or more joints that are affected within the first 6 months of disease onset. Next slide, please. Systemic GIA, characterized by arthritis accompanied by systemic symptoms such as fever, rash, and inflammation of internal organs. We then have enthesitis related GIA. Next slide, please. Psoriatic GIA and undifferentiated GIA. So those are the various forms of juvenile idiopathic arthritis. As earlier mentioned, I won't get into detail due to time. Now, next slide, please. Now, there were some questions. I don't know whether
But
Tracy,
the questions are not on this slide, but I can share them in the chat.
kindly, yeah, please
Okay.
do. I want us now to engage with the question, the first pretest, the first set of 3 pretest questions. So go to the slide before this, kindly. Okay, so as we try to get to the questions, I'd like to just begin by asking us generally, what would you think would be some of the mental health challenges being faced by JIA patients? Anyone? What would you think that the floor is opened? What would you think would be some of the mental health challenges being that GIA patients would be going through? Hello?
There is an
Yes.
answer on the chat.
Okay, yes, self-denial, stress. Thanks, Florence. Thanks, Stanley. What else?
Christina is raising her hand.
Yes, go ahead.
Yes, I would say depression, feelings
Yes,
of isolation and loneliness.
good.
Feelings of isolation and loneliness. I would go to the extreme and say parents and guardians should be looking out for symptoms of wanting to end a life. I'm putting it gently, because of the effects of being isolated, being discriminated on, not being able to be the normal child. The challenge,
Thank you very much.
challenges.
Great. Low, thank you, Esther. Low self-esteem. Yes, I see another hand is up. Christiana, you can go ahead.
It's a legacy.
Okay, thank you very much. Wilfrida? Wilfrida?
Yes, thank you very much. I hope you can hear me.
Yes, we can.
Thank you very much. I think some of the challenges, again, that patients of JIA can suffer from, number one is anxiety due to the pain that they go through. Number two is loss of self-esteem because they are not able to participate. They have participation restriction, like in play, they are not able to play like other children do. And because they also have activity limitations, so they feel like they are not able to participate in the normal activities that children of their age group are doing. So that can actually give them low self-esteem. Thank you.
Okay, thank you so very much. Anybody else? I see first, yes, thank you, Esther. Fatigue and frustration, fear, low self-esteem, anxiety, social isolation, lack of language to express themselves, stress. Anybody else? Okay. Now, can we all see what's on the screen right now? Hello? Hello?
Yes, Albert, I hope they can see the screen.
Yeah, just give me a thumbs up if you can see so I can know we are together. Just give me a sign, a thumbs up. Okay. On your screen, there are a set of 3 questions. Kindly please take note of them. Kindly take note of them. I'll give us about a minute for that before we proceed on with the session. So here with me, we have the pre-assessment questions. The first one is, what comes to mind when you think about holistic well-being in your personal life? Number 2, how do you currently take care of yourself when you're feeling stressed or overwhelmed? And number 3, note down an example of a challenging situation you faced and how you managed your emotions during this period. Okay, we'll come back to that later on. Kindly, Tracy, put back the presentation back to the challenges of mental health challenges of GIA patients. Thank you so much. So here we are. As mentioned, anxiety is a very key one. And here we look at things such as heightened anxiety about the future, concerns about the disease progression, worries about treatment effectiveness, fear of pain and disability. We also got depression, as was mentioned, okay? Remember, it is also triggered by the emotional burden of managing the illness and the impact it has on the daily life, relationships, and self-esteem. We've got stress, okay, due to the unpredictable nature of GIA, which includes the flare-ups of symptoms, hospitalizations, disruptions of daily routines, and causes significant stress for patients and their families. Next slide, please. Another big one, body image issues. And here, the adolescents, keeping in mind that particular age where they're very impressionable about how they look. So here, children and adolescents, they may develop negative perceptions of their body due to visible joint deformities, swellings, and limitations in physical function, okay? The body image concerns can affect their self-esteem, social interactions, and feelings of shame or self-consciousness. You also then have social isolation due to pain, fatigue, mobility limitations, and treatment regimens. Coping difficulties, okay? And here, difficulties may manifest as avoidance behavior due to the illness, and can result to withdrawal from social interactions or reliance on maladaptive coping strategies, such as substance use or self-harm. Another is family conflicts. Here, we look at interpersonal conflicts within the family. They could include sibling rivalry, resentment, guilt, and communication breakdown. It may arise among family members as they navigate the challenges of caring for a child with the illness. Now, before we move on to the next slide, next question. What do you think are some of the coping strategies for patients with GIA? What do you think some of the coping strategies would be like? Anyone? We've looked at the challenges. Now, how would they cope? Yes, spiritual intervention. Somebody else? How would patients now cope? Or how do they cope, those you know of? Yes, counseling, peers. Support groups, yes. Pain management techniques, very good. Family and friends. Exercising. Hobbies, yes. Heat and cold therapy, yes, especially on the joints. Good, yes, good professional support, very good. I like this special diet. Well, I'm not a nutritionist, but I would imagine, because it really affects the joint. So I believe foods that are rich, I believe, in calcium, vegetables, vitamins, fruits would be a good, and of course, proteins as well would be a good thing. And perhaps if there's anybody in the room who would who may be in a better position to address the diet, you're very welcome. Yes, Florence, express love, open communication, family support, right specialists adhering to the drug regime. Yes, multidisciplinary management, very good. Children acceptance, self-management strategies, education and empowerment. Great, very good. So now those are some of the many approaches that we could utilize, in as far as managing patients. We will delve into them a bit deeper just before I wind down my presentation. Thank you very much for those who have contributed. Now, on to the next slide, please. Okay, go to the, yes. Just go back to the one for patients, GIA patients. Yes. So as mentioned, we have pain management techniques. Here we talk about relaxation techniques such as deep breathing, meditation. We have techniques such as listening to music, watching TV, engaging in your hobbies. We also have applying heat or cold packs to affected joints to help reduce inflammation and discomfort. We then also have physical activity and exercise. Here we look at you engage in regular exercise so as to improve your joint flexibility, muscle strength. You choose low impact activities such as swimming, cycling, or yoga, which are gentle on the joints but still provide cardiovascular and muscular benefits. And of course, working with a therapist is very key. Good medication adherence. Here we look at take medications as prescribed, use reminders such as pill organizers, smartphone alarms, communicate any concerns or side effects to the healthcare provider. Next slide, please. Emotional support. Here you seek support from family members, friends, support groups. You talk openly about your feelings and concerns with trusted people. We also have got education and advocacy. Here you learn as much as possible about the condition, treatment options, and self-management strategies to become empowered advocates, communicate needs, preferences, and treatment goals. And then you advocate for accommodations and support services at schoolwork or other settings. Okay? Next. Healthy lifestyle choices. That is, eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins to support overall health and immune function. So there you go. There's the answer in terms of the diet. So a diet rich in fruits, vegetables, whole grains, lean proteins. Get adequate rest and prioritize sleep hygiene. Avoid smoking, excessive alcohol consumption. Have a positive outlook and resilience. Okay. You maintain a positive attitude and focus on strengths, abilities, and achievements, rather than dwelling on limitations or setbacks. And you practice resilience by adapting to challenges and bouncing back from adversity, and seeking out opportunities for growth and self-improvement. And always remember to celebrate small victories and milestones along the journey with GIA. Okay. The next one. Now, sorry, just hold it there. Hold it there. So now we have looked at the patients. Now it comes to the guardians. Next question, what do you think are some of the mental health challenges experienced by JIA guardians? You can share, either raise up your hand or share in the chat box. What are the mental health challenges experienced by JIA guardians? Denial, yes. Stigma, burnout, anxiety and depression, stress, financial difficulties, yes. Loneliness, yes. Fear, feeling unsupported, helplessness, low self-esteem, giving up, yes. Any other mental health challenge experienced by JIA guardians you can think of? Anyone else would like to give it a go? Blame, separation by society, yes. Anything else? Okay, kindly, Tracy, go to the slide on mental health challenges for JIA guardians. Okay, thank you for the reminder. Okay, just go to the top. Mental health challenges, The mental health challenges. Just go to the mental health challenges experienced by JIA the guardians. Okay, so I just ran through. You've got stress and anxiety, caregiver burnout, financial strain, emotional impact. Just proceed on. Next slide. Social isolation, impact on family dynamics. Here you look at the stress and strain for caring for a child with JIA. Self-care neglect. Okay, here guardians may prioritize their child's needs over their own. You've got guilt and self-blame. Here guardians may experience feelings of guilt and shame. Next slide. So coping for JIA guardians. Yes. So coping strategies, here are some of them. Seeking support, okay? Educate yourself, get to know more about GIA, practice self-care, that includes exercise, hobbies, and relaxation techniques, and spending time with loved ones. Next slide. Manage stress, okay? Here you can think of relaxation techniques such as mindful practices or stress-reducing activities, okay? Communicate openly, that's maintain open lines of communication with your child, other family members, and also healthcare providers. Next slide, please. Stay organized, have a system of managing your child's medication, appointments, and other healthcare related tasks. And then, of course, celebrate victories. Acknowledge this and celebrate the progress, milestones, and achievements on the journey with GI. Next slide, please. Go to this. Now, how to build resilience. This is also very important. We have got education and empowerment, and here we look at knowledge, whereby you provide comprehensive information about GIA. It just helps patients understand the condition and treatment options. We've got skills development, here we look at teaching coping skills, treat stress management techniques and strategies. We've got psychosocial support. Here we look at therapeutic interventions through counseling or therapy, and also support groups. Next slide. Strengthening social networks. Here we look at community engagement, engaging in peer support, and then finally we have promoting self-care. Here we look at what is physical health, things such as physical activity, healthy eating, adequate sleep for both patients and guardians. Then we have also emotional well-being. That is mindfulness practices, relaxation techniques, and hobbies that can enhance emotional resilience. Next. Good. So now, I know time has not been on our side, but these are just some questions I'd like you to just keep in mind. That one, how has your understanding of holistic well-being changed after? And number two, can you name one new self-care practice you plan to incorporate into your routine after this session? And number three, what's one specific way this session has helped you better handle difficult emotions or situations in your personal life? So, in summary, what have we looked at? We've looked at what GIA is. We've looked at the mental health challenges of patients with GIA. We've looked at the mental health challenges of guardians. And we've also looked at the coping strategies for both patients and guardians. And finally, we've looked at resilience building, because despite the challenge, we need to move forward and be productive and thrive in our day-to-day lives. Thank you very much. Over to you, Tracy.
Thank you so much, Albert, for those insights. It was a really wonderful session, and I hope you've learned a thing or two. I have also learned a lot myself. Thank you to the three speakers for sharing their knowledge, sharing what they know, and I hope it has empowered you. So I know we are out of time, but I really appreciate you for sticking around till the end of the session. I was going to share something very brief, a short presentation on our upcoming programs. So because of time, I'll make it very short, but this is very important information. So please stick around for the next 2 minutes to find out what we have. So we have an upcoming program for the kids suffering from rheumatic conditions. It's a workshop, a therapeutic patient educational workshop designed for children battling with rheumatic diseases. So they get to meet and interact with other kids, and they learn more about their disease using play games, using toys, fun activities, arts, and all that. So this is a really great opportunity for parents and their children as well. Even parents will get to meet other parents that are going through the same challenge. They get to interact and talk about, the challenges they are facing and what they can do. So some of the benefits of this workshop will, of course, be understanding their condition. They'll learn more about treatment plans. They'll get emotional and social support. They'll get to seek advice from each other, build confidence, gain healthy living tips, and of course, parental support for the guardians. So for the healthcare workers, we have a JIA Masterclass coming up in October. So it's similar to this, but only that it's more tailored towards the healthcare workers, such as doctors, nurses, and clinicians. You'll be getting more information of this on our social media platforms. But we also have a WhatsApp group. I have shared the link in the chat. So if you join our WhatsApp group, you'll be getting more and more information about our upcoming programs. So I highly encourage you to join. So if you're a healthcare worker in here, or you know one that may benefit from this masterclass, please encourage them to join us or go to our website and sign up. So we have a boot camp. Our boot camp is a 1 month intensive program for the healthcare workers where they cover the top 4 pediatric rheumatic conditions. So you may have missed out on our July cohort, but now we have another cohort coming up in November. So be on the lookout for more information about our boot camp. Then finally, we have our virtual academy. We have been talking about this on our WhatsApp group. We have been talking about this on social media. So this virtual academy helps you to learn about all these courses, the master classes, the boot camps, the webinars, and everything you learn on the go, and you learn at your own pace. So for instance, this JIA masterclass, I understand some of you are not able to join us on 14th, but you can still find this course on the academy. So you'll start from the beginning and you'll get to see all the materials and the session that you may have missed. And so it's a great opportunity for you to receive a certification for this masterclass. So I have already shared the link on the chat, but I will share it also on WhatsApp. So join the virtual academy, complete the course, and get your certification. I also encourage you to follow us on social media. Some of you may have seen us there. Kindly follow us. And again, join our WhatsApp community so that you may get timely updates and resources. Those are our contact details. Reach out to us for any questions that you may have, either concerning our programs or any questions that you may have towards our speakers. Maybe you didn't get an opportunity to ask. You can just send the question to us and we ensure that they respond to it. So that is all for today. Thank you so much for making the time to be here. Yes, that is all for today. Thank you so much and have a great weekend.
Thank you. Have a nice weekend.
Thank you. Bye-bye.